Hello, folks. Thanks for joining me today. And as we talk about remote physiologic monitoring and CMS reimbursement. And so this is a real world talk on how this could work for your medical practice. And I'm going to go through this pretty quickly. And as you have questions, you can put them in the chat or simply email me after the presentation and I can answer the questions offline. And so first, I want to just describe a little bit about what we're trying to accomplish here today. So we want to talk about RPM in the real world, what it really means for your medical practice, how you can implement it efficiently to make sure that it's good, it works for you and your staff as well as your patients. So why remote physiologic monitoring or RPM matters? So we conducted a study along with some students at UC Berkeley in the School of Public Health to see, does RPM really affect the behavior and improve the health of the patients that are using it? So in this example, we examined 80,000 patients that were using life scans, glucose meters, and we separated the ones that had been using monitoring before from the ones that hadn't. So our study was based on the patients that were new to self-monitoring. And we found that over time that the patients that started using the meters for the first time improved their overall control of the blood glucose level. So they brought it down to a controllable level within a couple of months of using the platform. And there's an example here in this graph of a patient that once they started using blood glucose level, a blood glucose meter, they were able to see that they were really out of control. And then over time, they either improved habits or improved other aspects of their life so that they were in control. So self-monitoring really does work in helping patients improve their health. And so what are the components of the actual RPM system? And what are the workflows that you would encounter as a practice? And so first, just to talk about the components in general. So the people are the patient, the provider staff, which could include non-clinical staff, and a billing associate. And on the system side, there is the smartphone that a patient may use to do the monitoring, whatever the device is that they're monitoring with, a device manufacturer app, and device manufacturer RPM platform, an RPM app, an RPM service platform, provider portal, and EHR. Now, it could be any combination of these, and I'll go through those scenarios in a little bit, but this is the totality of what's involved with an RPM monitoring app system. So this is an example of one flow. And in this case, a provider enrolls a patient using some type of provider portal. And then the patient receives a monitoring device. Either they acquire it themselves or the provider gives it to them. Then the patient downloads the manufacturer's app. That's the app that's provided by the manufacturer of the monitoring device. And then they establish an account. They take some readings. The patient syncs the device with the manufacturer's cloud platform, and then the manufacturer will send data back to the patient, to the medical practice's portal or their EHR. Now, this assumes that the medical practice has established relationship with the manufacturer beforehand, before the enrollment even begins. So there's an integration set up between the provider's EHR and the manufacturer's cloud-based platform. And so now at this point, the device readings are on the provider portal for the medical staff or the clinical team to look at, and then they can do the analysis and complete the whole cycle of what's needed for remote physiologic monitoring. And then the billing organization takes over from there and bills the activities to CMS. And so this is a workflow where the only people involved, the organizations involved, are the manufacturer of the devices, the clinical team or the practice team, which could include non-clinical staff, the patient, and of course the billing organization. So if we're looking at a combination, a hybrid of using a manufacturer's device, their app, and an independent RPM platform, this is what the flow may look like. And so in this case, the medical practice would use an app or a platform that's provided by the independent RPM platform company. The patient uses a monitoring device, and then the patient downloads the manufacturer's app, creates a login account on that manufacturer's platform, takes the reading, syncs it with the manufacturer's app, which effectively syncs it with the manufacturer's cloud platform. Then the patient downloads the independent RPM app, logs into the account with the RPM platform. So this is now the patient has a second app on their phone, and they're logging into the account credentials created by the practice when they were enrolled. Now the patient uses that independent RPM app on their phone to log into their account with the manufacturer's app, and now they're syncing basically the devices. So they're taking the device data from the manufacturer's cloud platform and moving it to the independent RPM app on their phone. And then thereby that data now gets transferred to the medical practice on their platform. And in which case the rest of the process is the same as the first scenario, where the practice goes in and looks at the data, conducts the analysis, and when that's complete, the billing organization can take over and bill all the activities. Now you see this is a little complicated. It's two different apps, two login accounts for the patient, and this is a workflow that does exist in real world. And so this is an example of a third workflow. In this case, it's just an independent RPM platform. In this case, the process starts the same. The medical staff enrolls the patient. The patient receives a monitoring device, and then they use the independent RPM app to sync directly with their device. So the patient takes readings on the device, and it syncs directly to that app. So there's no device manufacturer app or device platform that's used. A device manufacturer's web monitoring or cloud monitoring platform that doesn't exist in this workflow. And so the big difference between this and scenario one or flow one is that because we're using an independent RPM platform, you can use different devices and different manufacturers. It's not dependent on one manufacturer and the products that they provide. And so that's the big difference between using an independent RPM platform and a device manufacturer's RPM platform. The flow is the same, but the ability to have many devices and even monitoring different conditions changes with the flow 3. The other iterations, I'm happy to explore them in Q&A, or if you want, you can email me after the session and I'll describe it in more detail. So here are some opportunities. In particular, we're going to talk about CMS today, but these can apply to other opportunities if you're doing a fee-for-service practice. So with RPM, there are specific CPT codes that AMA, American Medical Association, has established for us to use, and these are the reimbursement rates that CMS has as of January this year. And so there are 5 CPT codes. 2 of them are related to each other. 99457, 99458 are the same activity. It's just that the second one is the additional work. So if additional management or services are required for that patient, then the billing rate drops slightly after the first 20 minutes. So in this, we're going to go through a quick scenario here just to explain from a financial perspective what this means for the practice. And so when you enroll the patient, you're actually training them at the same time. And so in our estimate, it's about 13 minutes worth of work to enroll the patient and train them on the device and make sure that they understand how to use the device, and that you get a one-time reimbursement for that of $19.73. Then once the patient starts taking the readings, the data is automatically transferred to the platform. So as soon as the reading's taken on an app as soon as the reading's taken on a device and it's synced with the patient's app, it's automatically conveyed to the provider portal, and thereby it's available through this automated process. That's an additional $43 a month. And then when the staff conducts an analysis when there are at least 16 days of readings during the 30-day cycle, then they can bill another $51.75. And so the net or the total opportunity for a year for one patient is $1,156.97 in the first year, and that equates to about 4.25 hours worth of work. And on top of this, there are the treatment management codes that I mentioned just in the prior slide. So if you have to communicate with the patient, you have to change treatment parameters, you have to have them do some coaching with them. That's all billable activity in the RPM world. And so those are billable against the 457 for the first 20 minutes and 499, 458 for the second and subsequent 20-minute sessions. So that could be an additional $574 per patient per year just on the 99457 if you have to do it every month with a patient. In addition, you can concurrently bill any chronic care management. So all patients that are in RPM are already diagnosed with some chronic condition. And so if you choose to do so, you can concurrently bill chronic care management in addition to RPM. And then there's also CMS merit-based incentive programs or merit-based incentive payments known as MIPS that can be available for your practice. So this is all in addition to the $1,156.97 per year that you can bill CMS for this patient. So here are the rules. Data has to be automatically collected and uploaded into the provider's system or the RPM system that the provider is using. That means that the device data, once it's collected by the device, so a sensor essentially collects the data, such as a blood pressure cuff, that data needs to be electronically transmitted from the device into the platform. It can't be manually entered by the patient. The device needs to be FDA, must be a medical device as defined by the FDA. In reality, this is a very broad statement. Any device that you feel is medically valid and clinically valid for the use of this patient to monitor a chronic condition can be considered a medical device by the FDA. It just has to be a device that you know is monitoring a specific physiologic measurement that is directly linked to that patient's health and the patient's chronic condition. The monitoring must be, in order for this whole program to work, for you to submit for the data collection and for the analysis, there must be at least 16 days of reading per 30-day cycle. So and that's not 16 readings, it's 16 days of readings. So 16 days of readings must be attributed. Doesn't have to be consecutive. It could be any 16 days in a 30-day cycle. And then that cycle qualifies for both the data collection and analysis. This must monitor an acute care or chronic condition. So you as a physician or as a medical practice need to diagnose the patient with some chronic condition that would benefit from daily monitoring. That could be prediabetes, diabetes, could be hypertension, and I'll go through some of those examples here in just a moment. And this is the wonderful thing about this whole program is the services can be provided by any auxiliary personnel. That's the specific definition that CMS has. That means it doesn't have to be clinical staff. It can be office staff. It just has to be under the supervision of the physician that provided the diagnosis or that's treating the patient for the chronic condition. So in most cases, the office staff are the ones training the patients on using the device, on syncing with their app, and even downloading the app. And so it's a wonderful opportunity to free up the critical resource of your staff. To focus just on the patient care, and you can have auxiliary personnel work on RPM. So again, the provider makes a determination of what condition would benefit from RPM, as well as the device that can be used. And so on the left-hand side, sample conditions can include these and many other conditions. On the sample devices are on the right-hand side. The critical item for us on the sample devices is that it needs to be able to transmit the data automatically to an app. So most of the time, an easy way to know this is if the device has a Bluetooth symbol on it, or it has some type of Wi-Fi connection, then we know we can probably get the data from the device into an RPM platform. And so your role would be primarily as a clinical team is to identify the condition you want to monitor, and your RPM partner should help you identify the proper device that's clinically validated for that condition that would also comply with the CMS rules for reimbursement. So here are some recommendations, real-world lessons for RPM. So you need to, this is a new process potentially for your office. And so you need to clarify what everyone's supposed to be doing. And so I'm going to just skip to the second part, which is really deciding on roles. And so somebody has to have the job of enrolling and training patients. Somebody should be going in every day to look at the dashboard to see what type of alerts have come across, whether patients missed the readings, have abnormal readings, or anything else. Could be also that the patients are ready for an analysis. They've completed a 30-day cycle or the minimum 16 days of readings. You also need somebody that's going to communicate with the patients, adjust the measurement frequency and thresholds for alerts, do the analyses, and then submit information for CMS reimbursement. Now, again, this could be auxiliary for items A through E. It could be auxiliary staff. It could be anybody in the office that you've trained and that's under your supervision to conduct this work. It could be even part-time staff. It could be anybody on a laptop that has the ability to get online at home and use the RPM platform. So this gives you a lot of flexibility as a practice of how you use your staff to accomplish this goal. And then the other critical item is really helping the patients get their devices. And so in some cases, the devices could be covered by CMS or by their health plan. That often all the blood glucose meters, blood glucose monitors, the testing supplies, they're usually covered for anybody that's diagnosed with diabetes. And those that are insulin dependent have even more flexibility in terms of the devices they can get and the testing supplies. Other devices are on a case-by-case basis, but your role would be to help the patient acquire the devices. In some cases, medical practices choose to acquire the devices for the patient to ensure the patient gets it in a timely basis and gets into the RPM program quickly. So purchasing the devices costs vary a bit. The blue box shows some examples of what we've encountered in our research. Again, the critical items is the device must need to transmit automatically from the device into the app. The devices could be reimbursed by the insurer, and again, these are some examples of some reimbursed devices include blood pressure cuffs, blood glucose meters, and test strips and weight scales. Okay. So let me go to the next slide here. So the critical lesson, or the most important thing is that patients have to comply. For this to work and be worthwhile for the patient, improving their health in the practice and improving their performance financially, the patient has to comply. And so our recommendation is train the patient in person in the office, schedule them to come in, enroll them while they're in the office so you can see them download the app, log in for the first time, and make sure they have the device with them so that they can actually practice using the device with you, take a few readings, make sure they're coming up on the platform as well so you can see them in the office. And then you should be in great shape just as a starting point. Monitor for noncompliance daily. Somebody should be checking at least a few minutes every day to see if there are alerts for patients that are noncompliant, and send them a message. Patients that know they're being watched and being monitored have nearly perfect compliance in our experience. If they're getting messages from the office, either via the app or via phone call or text message, they are far more likely to adhere to the parameters of their monitoring program. If there are any data sync issues, number one, tell the patient continue taking readings because we can resolve usually the data sync issues later, and have them come in so you can examine the device and their process to make sure that there isn't a problem with the app or the way that they're syncing the data. If there is a problem, even if you're not sure if there's a problem, just let the organization that sponsors the RPM services let them know right away. That way they can at least open up a ticket, provide support if there's a problem. It's really important that anytime there's a data sync issue, you resolve it right away. In some cases, it has nothing to do with the app or device. In one case, a woman that we were supporting had trouble connecting to the internet at home. And so we had to make some adjustments to her phone to make sure that she can use her data plan from a wireless carrier when she was in the range of a cell tower where she could do a sync. And then a final piece of advice on compliance is praise the patients. And so when you complete the 30-day analysis, send the patients a note or text message. Let them know they're doing a great job. And that encouragement alone is huge for the patients to continue complying with the RPM program. There are some suggestions for billing, and this is obviously critical for the practice and to maintain the program. Bill as soon as you have a qualified activity. That way you're going to learn from the experience of billing, and if there are any problems with how you're billing the different CPT codes, you'll learn quickly before it becomes a big mess and you have to fix a bunch of things later. The Look at your dates of service when you're billing things. Like you don't want to bill your analysis as a service date that occurred before the end of monitoring. So you want your monitoring service date, the end of that cycle to be before you enter in your analysis because you can't really conduct the analysis until you have enough data, to monitor. And then review rejections with your billing organization right away because it could be a simple adjustment of your process or an error in how they're submitting data, but you want to get those out of the way quickly also. Well, that was it. That was a very fast review of what we've learned from remote physiologic monitoring. And we hope it was helpful for you. If you have any questions, please email me at mark@otishealth.net. We'd be happy to answer your questions offline. Thank you so much for attending our talk.